In a surprising move that has raised eyebrows among food safety advocates, the Centers for Disease Control and Prevention, CDC, has quietly reduced the scope of a crucial surveillance program aimed at tracking foodborne illnesses. This change, which took effect on July 1st, has significant implications for public health monitoring. The Foodborne Diseases Active Surveillance Network, commonly known as FoodNet, has now limited its focus to just two pathogens: salmonella and Shiga toxin-producing E. coli, STEC. This decision was confirmed by a spokesperson for the CDC in a report by NBC News. Prior to this shift, FoodNet was actively monitoring infections caused by an additional 6 pathogens, including Campylobacter, Cyclospora, Listeria, Shigella, Vibrio, and Yersinia. Many of these pathogens can lead to severe or even life-threatening illnesses, particularly among vulnerable populations such as newborns, pregnant women, and individuals with compromised immune systems. The reduction in surveillance means that the 10 states participating in the FoodNet program are no longer required to monitor these 6 pathogens, although they still have the option to conduct their own surveillance independently. This change has sparked concern among food safety experts who fear that it could hinder public health officials' ability to accurately assess the prevalence of foodborne illnesses and detect any potential increases in cases. Dr. J. Glenn Morris, the director of the Emerging Pathogens Institute at the University of Florida and a key figure in the establishment of FoodNet back in 1995, expressed his dismay at the CDC's decision. Essentially, CDC is backing off on one of their best surveillance systems, he stated, highlighting the potential consequences of this reduction in monitoring. FoodNet is a collaborative effort involving the CDC, the Food and Drug Administration, FDA, the U.S. Department of Agriculture, USDA, and health departments from 10 states. It serves a population of approximately 54 million people, which accounts for about 16% of the total U.S. population. The states involved include Colorado, Connecticut, Georgia, Maryland, Minnesota, New Mexico, Oregon, Tennessee, and select counties in California and New York. In a statement, the CDC spokesperson noted that while FoodNet is narrowing its focus, it will retain its infrastructure and the high standards it has established over the years. The spokesperson explained that this shift in reporting requirements is intended to allow FoodNet staff to concentrate on core activities more effectively. A document shared with the Connecticut Public Health Department, which was reviewed by NBC News, indicated that one of the reasons for this change is the lack of funding that has not kept pace with the resources needed to sustain surveillance for all 8 pathogens. The spokesperson also mentioned that other systems are still in place to monitor the 6 pathogens that have been removed from FoodNet. For example, state health departments can report cases through the National Notifiable Diseases Surveillance System, and the CDC's Listeria initiative continues to collect data on laboratory-confirmed cases of listeriosis, a serious infection caused by listeria-contaminated food. However, food safety experts emphasize that FoodNet is unique in its active approach to monitoring multiple foodborne diseases at the federal level. Other federal systems rely on passive reporting, meaning they depend on state health departments to inform them of cases. This raises concerns that without active surveillance of all 8 pathogens, public health officials may struggle to track trends over time or identify spikes in specific illnesses. Furthermore, experts worry that scaling back FoodNet's operations could impede the swift identification and response to outbreaks. Barbara Kowalczyk, who leads the Institute for Food Safety and Nutrition Security at George Washington University, expressed her disappointment regarding the decision to reduce FoodNet's surveillance capabilities. Kowalczyk, who has been a passionate advocate for food safety reforms since her son tragically died from a foodborne E. coli infection in 2001, lamented that years of hard work aimed at improving food safety standards are now at risk of being undermined. She pointed out that the federal budget for food safety has not kept pace with inflation, and cuts to federal funding for state health departments have likely made it increasingly difficult to maintain FoodNet's surveillance efforts. The CDC has requested a budget of $72 million for food safety for the 2026 fiscal year, which is consistent with previous requests, but does not reflect the growing needs of the program. Morris voiced concerns that the reduction of FoodNet could signal a broader rollback of food safety regulations reminiscent of the Trump administration's approach. He warned, if you want to make foodborne disease go away, then don't look for foodborne disease. And then you can cheerfully eliminate all of your foodborne disease regulations. My concern is that that is the path down which we appear to be heading. In response to these developments, White House spokesman Kush Desai reassured the public, stating, "The health and safety of the American people is the administration's utmost priority. USDA, HHS, FDA, and the CDC will continue to cooperate and maintain the highest vigilance to safeguard our food supply against pathogens. As for the immediate impact of these changes on state-level surveillance, it remains somewhat unclear." Morris noted that the effectiveness of ongoing monitoring will largely depend on whether states can secure funding without CDC support. The health departments in Oregon and Connecticut confirmed they were aware of the changes, while the Georgia Public Health Department reported that it had not yet received official notification from the CDC. Meanwhile, the New Mexico Health Department is awaiting further guidance from the CDC to clarify the future of its surveillance efforts. The Maryland Health Department stated that healthcare providers and clinical laboratories in the state are still required to report cases of all 8 pathogens previously monitored by FoodNet, ensuring that reporting will continue regardless of the changes to the FoodNet network. However, the Colorado Department of Public Health and Environment indicated that it may need to reduce active surveillance activities for certain pathogens if funding decreases in 2026. This situation raises important questions about the future of food safety monitoring in the United States. Are we prepared to accept a potential decline in our ability to track and respond to foodborne illnesses? What are your thoughts on the CDC's decision to scale back FoodNet? Do you believe this will have a significant impact on public health? We invite you to share your opinions in the comments below.